All right. Hello all. This is my first time doing anything like this, so I'll try to keep it, short and sweet. This is my project. My issue was on consent, and why it's so important. All right. So what is consent? What actually is informed consent? Uh, It is the permission for something to happen or an agreement to do something. We see this all the time within the healthcare industry. When either it has something to do with releasing patient records or permission to perform a procedure on a patient. It is extremely important, and you will you will see that as we continue on to the next slide here. Okay, it's always nice to know a little bit of history, about any subject you're covering. I didn't spend a whole lot of time on the history of consent because I wanted to get more into, why it's important and the different forms of consent. However, I did find, this kind of interesting. Informed consent is a technical term, and it was first used by attorney Paul G. Gebhard in 1957. Uh, I thought this was pretty cool. And just a little quick background, kind of on the history of the word, uh, and then we'll keep it going and get into the different forms of consent, because this is really important. All right, so now we're getting into um, the meat of the project. Here we're going to talk about forms of consent. Um, there's many different forms of consent. These are three of the ones that you're probably going to see the most. It all depends. Definitely in the healthcare industry, these are the main ones. So we'll go through these real quick. Explicit consent. This is direct consent. When you sign off on a paper at the doctor's office or at a hospital in order for them to perform any type of procedure or release your records, disclosure of personal information, as I wrote there. Anything along those lines, this is explicit consent. Implicit consent is indirect. Usually this can mean two things, which I wrote on my slide here. You voluntarily personal information for organizational to collect. Disclose usually for obvious reasons. So this could be, your name. Um, if you go into your doctor's office and it's your first visit, maybe previous health concerns, that the doctor should know about prior to, you know, going back for your examination. Things along those lines is indirect. You're not necessarily signing for it, um, but it's still considered a form of consent. Then the last one is opt-out consent. The definition I have here is also known as giving consent by not declining to give consent. It means that an individual is given the option to decline the consent. If the individual does not clearly decline consent, then consent is granted. So pretty much this is pretty much exactly what it says here. When you opt out of something, you choose not to give consent to it. That is pretty much what we're working with opt-out consent. Um, we're going to move on and get into some of the laws and the ethics involving consent, as well as how it's related to patient-centered care, which is really important. And then we'll go to the next slide. Okay, so here we have consent and law. Um, Almost every single state has their own consent laws. Not all of them are necessarily the same. Some might vary with certain aspects. But there are some similarities with all the laws, and that is the relationship between the provider and the patients. These laws list the types of information that patients must be given. So they have to know exactly what they're signing for. What medical care are they signing off for, diagnostic tests, what type of treatment are they signing off for. These are required no matter what the state is. These are things that are related. That communication between the patient and the healthcare provider is so crucial when it comes to consent. And making sure that that patient knows exactly what they're consenting for. You do not want to leave anything blank. You don't want to make sure that they are real clear on what they're signing for. Another thing is that not some patients might not be able to understand or make decisions on their own. If this is the case, then you'll need consent from whoever's legally responsible for that individual, as I wrote down there. That can be, so think of things like children, young children that can't necessarily make their own decisions by themselves. Their parents might be legally responsible for making decisions for them, and that is fine. It could also be the other way around. You can think of the elderly, which we've covered a lot in this class, about families involved with their older loved ones. Sometimes they'll be in charge of making a decision, but whoever's making that legal decision, or who is authorized to make that legal decision, if the patient themselves is not able to consent, has to make that consent for them before anything is done regarding procedures, treatments, records, diagnostic testing, anything. Somebody has to consent, if not the patient themselves. All right, and we're going to go into consent and ethics on the next slide, which is also very important. Okay, now we're going to get into the topic of ethics and consent, or consent and ethics. This is really important. Definitely, it is considered unethical, actually extremely unethical, to perform a procedure, release records, or anything along those lines without getting consent from a patient prior to doing so. It impacts the patient's autonomy and basic human rights. This is why it's so important, and there can be serious consequences for the doctors, nurses. Someone's going to be liable if consent isn't given prior to performing anything or releasing records. It's unethical, and that is important to keep in mind, that receiving consent from a patient prior to doing just about anything is ethical. And when you decide not to do that, not only is it unethical, but there's definitely could be some legal consequences, and that's important to keep in mind. That pretty much sums up with the ethics. It's just about keeping the patient's autonomy and the basic human rights, and that's the most important thing. Patients have the right to decide what happens with their body, what tests they want done on their body, what procedures they want done on their body, what surgeries they want done on their body, what medications they put in their body. These are all the rights that we all have as humans in the United States, and it is unethical to do anything involving this without the consent of the patient. We're going to move to the next slide now. All right, who is liable? I briefly touched on the importance of consent in the ethics slide, and I talked about how someone's going to be liable if consent is not given. So this slide kind of goes in more detail of who might be liable. Oftentimes doctors, surgeons, sometimes nurses, as I wrote down here. Upper management, sometimes supervisors might be liable. Um, and unfortunately, even if they weren't the ones there to actually make sure that consent was given, um, once a doctor or a surgeon performs that procedure, they still might be liable. So just because they were not present to get the consent from the patient, if they follow through with the procedure and the patient has never signed off or doesn't even know what the procedure is or what's being done, if this were to ever occur, that surgeon or that doctor could still be liable. Um, and this is, that's unfortunate, but that's unfortunately the way it is. We're going to go into patient-centered care and kind of see how that relates to consent as well. And we'll head that way. All right, patient-centered care. This is exactly how it sounds. The patient comes first. Healthcare providers make sure that all their care is given with the patient's best interest. They try to make the patient as comfortable as possible. And this is usually what most healthcare providers strive for. However, this is not how all of them are. But this is how they all, in my opinion, should be. But what does that have to do with consent? Well, if you ever go to the doctor's office and you see this long, lengthy, wordy consent document that, honestly, I know many people don't even read. They kind of just take the pen and sign it, which I can understand. But patient-centered is focused on keeping the consent forms shorter, more patient-friendly, which is why it's patient-centered care, but yet still informative. We want to minimize the burden on the patient to have to sit down in the waiting room and read pages on pages on pages of consent forms. That's just not fun, and it's not efficient either. There's better ways to make use of the time while still giving all the informative information that the patient needs, and that's the goal. Shorter consent forms, more verbal communication, more patient to provider communication versus sitting in the waiting room and looking at the form that's long and dry. That's what you want to kind of think about when you're relating consent to patient-centered care. Once again, we're relating everything back to the patient, whatever is best for the patient, whatever is in the patient's best interest. That's what we're looking for. I'm gonna move on to the next slide now. All right, obtaining consent. This is just as important as the consent itself. It goes back to what I was saying about making sure that the patient knows exactly what they're consenting. If a patient walks into your office and you just say, here, sign this, and the patient goes ahead and signs this, not knowing exactly what they're signing for, you are not doing things correctly. Anytime you give a consent, or you have a consent form, or you are looking to receive consent from a patient, you need to look for these things here. These things need to be included in there. You need to just have a description of the reason for the treatment you're trying to provide to this patient. You need to explanation of the test or the treatment. What exactly is the treatment entail? What is going to happen during the process of this treatment. The benefits and the risk. Why would the patient want this treatment? You know, what is the reason that the patient has to get it? I mean, what are the benefits? What are the risks? What are the reasons why the patient might choose not to get the treatment? That matters as well. Are there any alternative treatments? Is there any other options that might have less risk, more benefits? Those are things that you want to consider as well. And then you also want to explain to the patient, you know, the possible consequences if the treatment is declined, or if the patient doesn't choose to go to consent to the treatment. You know, let them know, you know, that, you know, that's their right, that's fine, but make sure that they're aware of the possible consequences of doing so, so that they, you know, are not blindsided in the future when they might occur. All right, we're going to wrap it all up in the next slide. We'll see y'all there. All right, so we have come to the conclusion of my project or my presentation. Hopefully everyone that is, you know, decided to read it or listen to me has, you know, learned something or been able to take some aspect of, you know, the project out, and that they didn't know about or that they learned. The main things is, you know, consent is important in the healthcare industry. It is extremely, extremely, extremely important. Understanding the laws of your state, how ethics is involved, is also extremely important. You know, it's not ethical to not give consent prior to releasing a patient records or treating a patient in any shape or form. These are really important things. Patient-centered care, this is something I feel that goes under the radar. You know, this is important. You want to make the patient feel as comfortable as possible, while keeping the burden off of them as much as possible as well. Which is why, you know, on that slide I kind of explained ways in which you can do that by shortening the consent forms, more verbal communication. You know, these are ways that help benefit a patient-centered care atmosphere or environment when you go to a healthcare provider, whether it's your general doctors or a hospital, a dentist, or an eye doctor. You know, it doesn't matter. These are all things that, you know, you want to look for, and that's, you know, that's about it for my project. I hope everyone enjoyed. On the next slide, we'll have my sources. I use many of them. So we'll head to that slide and then wrap up the entire thing.